Hey mate, glad to have you here. If you're over 50 and starting to notice some changes in your sexual health, you're definitely not alone. And today, I want to talk with you about something that's been helping a lot of men around Australia, a medication called Tadalafil. Maybe you've heard of it. Maybe your GP mentioned it. Or maybe someone at the pub brought it up. Wherever you're at, this video is going to give you the full picture from how it works to whether it's right for you and what to look out for. Stick with me until the end, because I'll also cover a few surprising facts that most guys don't hear at the doctor's office. Now, Tadalafil is part of a class of drugs known as parade 5 inhibitors. The job of this medication is pretty straightforward. It helps increase blood flow to the penis when you're sexually aroused. That extra blood flow makes it easier to get and maintain a firm erection. Now here's something a lot of men like about it. Compared to other ED meds like Viagra, Tadalafil lasts much longer. It kicks in within about 30 to 60 minutes, and the effects can last up to 17 or even 36 hours, depending on your body. Now don't worry, that doesn't mean you'll be walking around with an erection for a day and a half. It simply means your body is in a more ready state. When the moment comes, you're more likely to respond. And here's the thing. It only works when you're sexually stimulated. You won't feel anything if you're not in the mood. That's important to understand. It's not an automatic switch, it just makes things easier when the time's right. So how do you take it? There are a couple of options. Some men take 5 milligrams daily, especially if they're in a relationship and want more spontaneity. Others prefer to take a 20 milligrams tablet just when they need it, say, a few hours before sex. In some places, you'll also find sublingual tablets or even sprays, but here in Australia, the regular oral tablets are still the standard. And remember, regardless of how you take it, there still needs to be desire and stimulation. No pill can replace that natural spark between you and your partner. Now here's where things get interesting. Tadalafil isn't just for erectile dysfunction. It's also prescribed for benign prostatic hyperplasia, or BPH, which causes urinary problems in older men. Taking a small daily dose of Tadalafil can actually help improve urine flow and reduce that frequent urge to go, especially at night. Some men also use it to help with premature ejaculation, but only when that issue is linked to difficulty maintaining an erection. And yes, I know there's talk in some gym circles about using Tadalafil to boost workout performance. I'll be honest, that's not a safe or proven use, and I'll be doing a separate video on that soon. So hit that subscribe button so you don't miss it. Now, one of the questions I get asked the most is, what's the ideal dose? Well, there's no one-size-fits-all answer. Some men feel great on 5 milligrams a day. Others prefer taking 10 or 20 milligrams occasionally, depending on their schedule and their partners. It really comes down to how your body responds. Always start with the lowest effective dose, and only increase under medical supervision. Too much Tadalafil isn't going to make things better, and it could actually backfire. Another question that comes up a lot, does it work for everyone? Unfortunately, no. Studies show that up to 35% of men don't see the expected results. That number goes up to 44% in men with diabetes, and even higher in men who've had prostate surgery. But don't lose hope. In many of those cases, doctors can explore combination therapies or alternative treatments to help you regain confidence. Here's something you should know that most guys don't talk about. While Tadalafil doesn't cause physical addiction, some men do develop a kind of mental dependence. They start to feel like they can't perform without it, and that can create unnecessary stress or anxiety. So if you're starting a treatment, have a plan for the long term. Work with your doctor. Maybe look into sexual therapy or even devices like vacuum pumps if needed. It's all about building confidence, not just relying on a pill forever. As for side effects, most guys tolerate it pretty well. The most common ones include headaches, stuffy nose, muscle aches, and back pain, especially in the lower back. Usually these symptoms are mild and go away on their own. But there's one side effect that's more serious, and it's rare. It's called priapism, and it means an erection that won't go away after 4 hours. If that ever happens to you, go straight to the hospital. It's a medical emergency, and if it's not treated quickly, it can lead to long-term damage. That's why it's so important to take this medication only with a doctor's guidance. It might feel harmless, especially if you see others using it casually, but trust me, when it comes to your health, always play it safe. And here's one last point before we wrap up. Over time, some men notice that Tadalafil stops working as well as it used to. That could be due to health conditions getting worse, like diabetes or heart issues, or even just emotional stress. If that happens, don't keep upping your dose without talking to your doctor. There might be other solutions that work better for you now. Sometimes a little change makes a big difference. Alright, if this video helped you out, hit that like button and drop a comment below, even if it's just to say thanks or ask a question. I read all the comments, and I'll be replying to as many as I can. And don't forget to subscribe, because this channel is all about helping Aussie men over 50 live stronger, healthier lives without the awkward stuff. We are here to talk honestly and help you take charge of your health. Thanks for watching, take care, and I'll see you in the next one.